Hello and welcome to Many Voices, Many Visions. I'm Norma Holland. This week, we'll learn about the March of Dimes Nurse of the Year celebration and what goes into choosing a winner. We'll look at the profession of nursing itself from the perspective of someone who trains them. Plus, a Rochester City neighborhood gets ready to celebrate its history. We'll talk to the organizers of the 21st annual Clarissa Street Reunion. Up first, though, we have Deborah Stamps. She is Assistant Vice President, Quality, Safety, and Innovation from Rochester Regional Health. We thank you for joining us.
Good morning. Thank you for having us.
And seated next to her is Adrienne Mann. She is Director of Nursing for the Women's Care Unit and Medical Surgical Units at Rochester Regional Health, and you're a gala co-chair. Thank you for joining us.
Thank you for having us.
So this is a wonderful event that is celebrated each year in honor of local nurses who make a difference every day in the lives of people who they care for. Yeah. And you have nurses from a variety of backgrounds. Tell us about the different categories and then how you go about selecting those who will be honored in each one.
Wonderful. Thank you, Norma. We have 96 nominees this year.
Wow.
Nurses from around the upstate New York area. And we actually have 11 categories that are for the nominees to select from. So categories such as advanced practice nurses, which includes like clinical nurse specialists, nurse practitioners. We have researchers, nurse researchers. And we also have maternal child care nurses, med-surg, emergency department, critical care, the list goes on. And the selection, how this happens is that nurses are nominated online. Could be a member of their family, a patient, co-workers that would nominate the nurse. The nurse then has a part to complete, and then we have a selection committee for each of the categories. And it's a blinded review, very intense,
very
sounds
competitive.
Intense, and then we have the opportunity to award nurses this wonderful recognition. Over the past few years, Rochester Regional Health, this is our second year being a premier sponsor of the event, and over the last few years, we've actually had 300 plus nominees just from Rochester Regional Health.
That's amazing.
And so, and of that 300 plus, 20 have actually walked away as recipients of this recognition.
Wow. So the Nurse of the Year, again, many different categories, nurses of all different backgrounds. And as you talk about the nurses, there's so many different backgrounds. I'm surprised to hear about some of them. We'll talk about that in a little bit.
Wonderful.
It goes to show you how varied a career nursing is. We don't, it's not all bedside care. It's many different categories. Yeah. This is a really wonderful event. Nurses and as Deborah said, very competitive. This is something, it's an honor. But for these nurses, it's an honor to be a nurse every day, isn't it?
Absolutely. I think that the nurse goes into this knowing that they're here to care for not only the patient themselves, but the extended family, parents, grandparents, siblings. That's for our child development years. And then as they get older, our older population, we're taking care of our patients that way also.
Yeah. You talk about how nurses care not just for the patient, but also the families that inevitably come visit the patient.
Absolutely.
And I remember when my mother was in the hospital several years ago, we felt cared for by the nurses. We really did. And it was something I hadn't expected. When you think of nursing, you think of the patient, the nurse-patient relationship. And that is so sacred, but we're a part of it too.
Exactly. The relationship-based care is key, and that includes the family, the patient, their extended family, even, that transition of care, and that's a role that nurses are taking a larger role in, is the transition of care of patients from office practice to the hospital to nursing home, even back to the community. So nursing has some non-traditional roles that are really becoming quite popular.
Yeah. This is an event that's happening on the 16th of September, which is not too far from now, at the Rochester Riverside Convention Center. Tickets are still available if you'd like to attend. I can only imagine that it is a very uplifting event. nurseoftheyear.org/upstate-NY. It's from 6 to 9 p.m. If you're interested, it's an evening event this year. and it is one that no doubt will inspire you. And if you've nominated a nurse, I know you'll want to be there. I've known nurses who I've cared for, who've cared for my family, and who have made such a deep impression on us. And it's wonderful to see people being honored for the good work that they do. We're going to take a break, but when we come back, we'll discuss with Adrian and Deborah the role of nurses today, how they are changing to accommodate the needs of a changing population, and the outlook, the future of nursing. March of Dimes getting ready to celebrate its now 6th annual Nurse of the Year Award. That is coming on Friday, September 16th at the Riverside Convention Center. nurseoftheyear.org/upstate-NY is where you go for more information and get tickets to attend this event. It's an evening event from 6 to 9, so more of a gala feel really is what it is. And with us we have Adrian Mann, Director of Nursing at Rochester Regional Health and Gala Chair, and Deborah Stamps. She is Assistant Vice President, Quality, Safety, and Innovation for Rochester Regional Health, and we thank you. When we left, we were discussing the role of nurses today and how this award honors nurses in so many different categories. Yes. And it really is a testament to the way nursing has changed over the years, hasn't it?
Yeah. Absolutely. I think it's become more evolved in the fact that we care more for the families and the patients, and we are still giving them medical care, but we are also worrying about their social aspects and their cultural diversity that they experience outside of the hospital, and recognizing that not every family fits into the same mold as the others.
That's interesting. So more personalized kind of care.
Absolutely.
That's interesting, because you would tend to think that there would just sort of be, I guess, I don't want to say cookie cutter approach, because that's not what I mean,
No,
but that there is a standard and patients either fit it or don't.
Absolutely.
That's not how medicine is
We have
today.
to be extremely diverse. We have to recognize the needs of each individual patient, especially in our population here in Rochester. We have multi-diverse families and come from other areas in the world, and we have to adapt to them, and we recognize that, and we treat each patient to their own accord.
That's interesting. So you've got the refugee population, people who are not of this country who come here.
Yeah, English is a second language.
Yeah.
Yeah, lots of cultures, you know, and how, and there's health traditions that are non-traditional ways of caring for yourself that we also have to take into consideration when we're planning those transitions. You know, a role that is becoming more and more focused is that transition in population health. How do we get our communities healthier? And so community outreach, actually nurses doing research or partnering with other organizations to conduct research, like organizations like the March of Dimes, have been integral in, you know, how do we prevent prematurity from happening.
And, you know, we talk about this. I know you have the centering tools at RGH there, or Rochester Regional Health, and one of the things, I've had nurses here to discuss that program, but that's that whole thing of, you know, and March of Dimes has been so adamant and vocal about, you know, waiting as long as you can before you have your child, and not having a child too early.
Yeah, 39 weeks is our goal. The research has shown that babies do better the longer they can stay inside mom and getting that nurturing and getting ready for the external world. The work of the March of Dimes really connects well with the research piece, the community advocacy piece. The March of Dimes also, and nurses are advocates out, you know, at Albany, advocating for legislation as well. So there's a lot of roles that nurses fill today. Not to mention the opportunity for, and which is also a category for the Nurse of the Year, is our nurse educators, our professors who are teaching the future nurses to come out into our communities and work and take care of our patients.
Our special care nursery is extremely engaged with the March of Dimes. They've actually stepped up to the plate a lot. They've participated in the walk that they had in May.
In May.
And they also had a bake sale within our hospital and raised quite a bit of money just going around from floor to floor and unit to unit in the hospital.
That's great.
So they do a lot of extra added touches to be engaged with the March of Dimes, and they're wonderful with our patient population. They keep in touch with the patients once they go go home. There's some of our nurses that still go to birthday parties of the patients that they've had in the special care nursery.
Really?
Yes.
Oh, I can only imagine each and every one is so special, right?
Absolutely.
Family caring for family.
This event, again, is open to the public, and they would love for you to be there. nurseoftheyear.org, upstate NY, Rochester Riverside Convention Center from 6 to 9. And it is Friday, September 16th. It is coming up fast. The 6th annual March of Dimes Nurse of the Year Award. Now, before we let you go, there's how many categories again now? 19?
There's 19 categories. We had 96 nominees this year.
Okay.
54 from Rochester Regional Health.
That's great.
Which we're really excited about. And,
96 entrants, really. So
yes.
In the future, do you maybe believe, or do you believe you might have more categories even for nursing as the population changes?
As it changes, absolutely. Absolutely.
That's great.
We could definitely grow this event.
Nursing's not static. It is fluid. Really, it is. Yeah.
Yes.
Well, we thank you both very much for joining us today.
Thank you very much.
Yeah, and we'll see you at the awards on September 16th, that Friday night at the Riverside Convention Center. Congratulations to all you nominees out there who are watching. I'm sure that they're going to be so nervous that night, but this is a great night for all of them.